Hello everyone, I welcome you all for today's lecture on minor connector. As the definition says, the minor connector is the connecting link between the major connector and other units of the processes such as your direct retainer, indirect retainer, occlusal rest, cingulum rest, etc. So as discussed in the definition, the main function of minor connector is to join the major connector to the other components of the cusp denture. And the second function is to transfer and distributes the occlusal or functional forces to the abutment teeth and residual ridge. It also transfers the effect on direct retainer, indirect retainer, rest to the remaining components of the cusp denture. So coming to the classification of minor connector, there are mainly four types of minor connector: clasp assembly or direct retainer minor connector, indirect retainer minor connector, denture based minor connector, and approach arm minor connector. Clasp assembly minor connector. So clasp assembly minor connector joins the direct retainer to the major connector. It should be, ideally it should be rigid. It is of two types depending upon the location. So as you can see in the picture, here it is a class 3 situation where there is a edentulous space bounded by teeth both in the anterior and posterior region. Here you can see a direct retainer which is arising from the edentulous area. So the direct retainer is connected to the major connector via your clasp assembly or direct retainer minor connector. In type 2, here as you can see in the picture, it's a class 1 or a class 2 situation where the clasp assembly arises from the embrasure area between the two distal abutments. So the direct retainer is between the embrasure area between the two premolars, that is the distal abutment, and the direct retainer is connected to the major connector with the help of direct retainer minor connector that is arising from the embrasure area. Indirect retainer or auxiliary rest minor connector. So indirect retainer or auxiliary rest is usually given in cases of class 1, Kennedy's class 1 or class 2 situations. So in the picture you can say it's a class 2 situation. There is a unilateral edentulous area on the opposite side of the edentulous area where you can see a indirect retainer that is given in between the two premolars. There is a rest that is attached to the major connector with the help of indirect retainer minor connector. Also, there is a clasp assembly along with a rest that is given on the second molar that is called the auxiliary rest. This auxiliary rest is connected to the major connector with the help of indirect retainer minor connector. Ideally, it should form a right angle with the major connector. As you can see in the picture, it forms a 90-degree connection between the rest and the major connector. Coming to denture base minor connector, this joins the denture base to the major connector. There are basically three types of denture base minor connector: lattice type, mesh type, bead wire or nail head construction. So now we'll discuss lattice type of minor connector. So lattice type means there is two metal struts. One runs longitudinally along the edentulous space. These two longitudinal struts are joined by smaller strut that runs across the crest. The space between the anterior and the posterior struts depends upon the tooth to be replaced. So if you want to replace a molar will have comparatively more mesodistal dimension than a premolar. So the distance between anterior and posterior strut should be comparatively more. In the maxillary arch, the border of the major connector palatally act as the second strut. The lattice work construction provides the strongest attachment of acrylic resin denture base compared to all other denture base minor connectors. So coming to the indication, if relining is required in the future, lattice type is the most easiest to reline, and it is also indicated when multiple teeth to be replaced. Mesh type of minor connector. Here it is a thin sheet of metal with small holes. Extension is similar to your lattice type of minor connector. It is also indicated when multiple teeth to be replaced. Compared to lattice type, mesh type does not provide a strong attachment between the acrylic resin and the denture base minor connector. Bead wire or nail head minor connector. Here the denture base is directly in contact with the underlying soft tissue. There is no acrylic lining below the denture base minor connector. No relief is provided here. It is indicated in case of class 3 situations. The acrylic resin is attached only onto the superior surface of the metal base, and the retention is by use of bead wire or nail heads. Since the metal is in direct contact with the soft tissue, there is a better tissue response to the major connector. It is indicated on tooth support, as we discussed. It is indicated on tooth supported well healed ridges where relining is not anticipated in the future. Disadvantage is that it has the weakest attachment between the acrylic resin and the denture base minor connector, and it cannot be relined. And the last type of minor connector is your approach arm minor connector. So here the direct retainer or the eye bar is connected to the denture base minor connector with the help of approach arm minor connector. It is the only minor connector that is not required to be rigid.